Kia ora, me karakia tātou. Whakatakatia hau ki te uru, whakatakatia hau ki te tonga, kia mā kina kina ki ta, kia mā taratara ki tai. E hi ake ana te atākura e he tio, he huka, he hauhu, ti hei mauri ora. Tēnā koutou katoa, he mihi mai oha ki a koutou, kua taimai nei ki te tautoko te kaupapa tēnei rā, nau mai ki tō mātou kōrero. I'm Moira Clooney, I'm project lead for Te Ngākau Kahukura and privileged to be part of this conversation today about gender identity conversion practices in Aotearoa and how we can stop them from happening. Te Ngākau Kahukura has a vision of Aotearoa where rainbow people grow up being safe and valued and feeling like they belong in all the places where they live, learn and access healthcare and social support. So conversion practices are pretty fundamentally incompatible with our vision. Trying to change or suppress people's queer, trans or intersex identities is misguided, harmful and unacceptable in our view. So we really welcome the government's proposals to ban conversion practices, but we've called today's session More Than a Law Change, really for two reasons. One is that this means more to our communities than just creating a new law. It's a signal that as a society, as Aotearoa, we're ready to move on from this part of our colonial heritage to accept rainbow people as part of the whānau. And the second reason I guess this is more than a law change is that this will take more than just legally banning conversion practices to stop them from happening. It's going to take education and support. It's going to take shifting attitudes and practices in our health services, within our religious communities and in our whānau. I'm joined today by my colleagues, Jono Sellu and Joey McDonald, and also by our friends from the Trans Health Research Lab at the University of Waikato, Dr. Jamie Veal and Jack Byrne. So just before I hand over to them to let you know a little bit about how this session will run, we'll hear from Jack and Jamie about some new research from Counting Ourselves about gender identity conversion practices in New Zealand. We'll have a bit of a kōrero amongst the five of us about what that research means and what we think it suggests about how we can stop conversion practices happening in this country, and then we'll have a bit of space at the end for any of your questions. So some of you might have sent through questions beforehand. For today, if you've got a question, just pop it in the chat and we'll choose a few of those at the end to address. We might not get a chance to cover off all the questions that you have today, so I really encourage you to check out our websites, read a bit more, and please do get in touch if you want to ask us anything else. So with all that said, I'll pass over to Jack and Jamie to share their research findings. Kia ora kōrua.
Kia ora Moira. Ngā mihi ki ngā mana whenua o tēnei motu nō reira tēnā koutou katoa. Called Jamie Veal taku ingoa. I'm Jamie and I'm here today with my colleague Jack. Thanks for introducing us, Moira. And yeah, I just want to say that thanks for the great introduction, and I really like the way that you frame this around thinking about what it means more than a law change, in terms of thinking about how it might be impacting on the society more broadly, including, you know, obviously people's attitudes and what might it look like, so that it wouldn't take just a law change to actually stop people practicing these harmful events or practices. So yeah, I'll get on to start talking about the research then on the next slide. Counting Ourselves is, I'm hoping many of you will have heard of us, but for some of you this will be a bit of a refresher. But we're led by trans people, so Jack and I are both trans, and we have had many other trans and non-trans people in our team. We have had a very diverse, with as much diversity as we could find, with a community advisory group of trans people who really went along the journey with us all the way, in terms of advising us on how to make this research most appropriate for our communities. It's also kaupapa Māori informed research. We yeah, we were really, it's been really important to us right the way through that this research is going to be used to inform policy and practice. So, for example, we work with, so I mentioned there are agencies like Statistics New Zealand, Ministry of Health, but we really engage with it with a broad range of people who are involved in policy or even health professionals as well, thinking about the questions that they might find the most useful, and we included questions based on those. We're also really interested in, for example, how trans people are doing compared with the general population. So a lot of the questions that we use are ones that are ones that appear in our general New Zealand Aotearoa population surveys, like the General Social Survey or the New Zealand Health Survey. So data were collected in 2018. And we had 1,178 responses from people, and to participate, you needed to be trans or non-binary, living in Aotearoa, and age 14 or older. So we first released our findings, which had the first findings of the number of people who have been exposed to these conversion practices. It was over a year ago now. But what we've been doing since then is, as well as we've been doing some more academic analyses. We've also been working on community accessible or more community accessible type publications like the fact sheet that also accompanies this work. Yeah, we've been seeing our work being picked up and being used in, with community groups, community organisations, and also we've been seeing it cited, for example, in government reports and briefing papers, or when the first reading of the Conversion Practices Bill was introduced into Parliament by a number of MPs, for example, as well. Okay, over to you, Jack. Are you muted, Jack?
Yeah, kia ora koutou, ngā mihi mahana kia koutou. We're aware that like some of the terms that our communities have used in the past are a bit different from some of the terms that, you know, sometimes you now see talked about overseas or in research. So we wanted to acknowledge that the terms have moved from, in the past we talked about conversion therapy. Well, of course, none of what happens, none of this harm is therapeutic. And that's why the language has moved away from that to either conversion practices or, yeah, so conversion practices is quite commonly used, but it's a focus on what the intention of those practices are, which is that it's actually about changing or suppressing who we are, suppressing someone's takatapui or rainbow identity. And these are harmful, unethical, and they don't work particularly over time. And often people are coerced into seeking these practices, and the power of the people around them who they love or trust or rely on for their support. The language that we've tended to use is either gender identity conversion practices or gender identity change efforts. That's because of that focus on trying to change people. And it's gender identity for our research because we're looking particularly at the experiences of people who answered Counting Ourselves when someone was, a health professional was trying to stop them being trans or non-binary, was trying to change their gender identity. These conversion practices falsely assume that being trans or non-binary is an illness, that it's pathological, it's wrong, it's undesirable, it's evil, it's sick. And it can occur in many settings and be performed by many different individuals or groups. And I think there's a real lack of data and research right now in Aotearoa about that diversity of experiences. So this was the data we had. I'm sorry the next door neighbours just started mowing the lawn. I hope it's not too loud for you. On the right there is the question that people had. It was in a question in a part of the survey where people have been talking about accessing gender affirming care. And they were asked, has any professional, such as a psychiatrist, psychologist or counsellor, they were just examples, ever tried to make you identify only with your sex assigned at birth? In other words, if they tried to stop you being trans or non-binary. And This figure is slightly different from the one that you will have seen in Counting Ourselves report, because for this one, we looked at the 610 participants who had ever spoken to a health professional about their gender. So when we look at that slightly smaller group, it's almost 1 in 5 participants that this has happened to. It had a health professional who's tried to stop them being trans or non-binary. And young people in our survey, that's those aged 14 to 25, were more likely to report conversion practices than our older adult group. And you can see the data there. So they were more likely to say, yes, this has happened to me, or I'm not sure, I don't know if this has happened to me. And I wouldn't underestimate that I don't know, because I've worked in the region on data around people's experiences of conversion practices, including interviews with people. And a lot of people, by the time you get to the end of the interview, go, I never realized that that's what you call it. I didn't have that word for it. And I think that's particularly the case around some of the experiences of trans or non-binary people, because it's also when people refuse to provide care for you that you want. They refuse to give you access to gender affirming care because they don't think it's good that you should have that. They don't want you to identify as trans or non-binary. Over to you, Jamie.
Kia ora, Jack. So this is a finding that's come out more recently, and in an academic publication, which we're going to speak to a bit more detail today. But the key finding here was that Counting Ourselves participants who had experience or had exposure to these gender identity conversion practices, the ones that Jack, the number that Jack mentioned on the previous slide, that they were more likely to have worse mental health. So one of the ways that we measure mental health was a scale that they used in the New Zealand Health Survey, which measured psychological distress, which includes depression and anxiety. So what we found is this scale, based on, has response options, which go from like strongly disagree to agree, strongly agree, and you could end up getting a score of psychological distress, which goes from 0 to 40. And what we found was that those who had exposure to these gender identity conversion practices scored about 5 points on average more highly on the psychological distress scale compared with those who didn't report exposure to these gender identity conversion practices. So as well as this being, we did some statistical analyses and found that this was significant statistically. We also looked at, the scale itself, and we saw that the Ministry of Health did have different categories which it uses for the psychological distress scale, which go from, I can't remember the exact wording, but something like low or moderate and high and very high. And for some of those categories, it was just a 5-point difference to go from those different categories. So that perhaps gives a little bit of an idea of, I guess, the clinical significance of this effect that we're seeing as well. We also looked at how it was related to non-suicidal self-injury, and there was more than 2 times the likelihood of non-suicidal self-injury and also suicidal ideation for those who had exposure to these gender identity conversion practices. And with suicide attempts, it was more than 4 times greater likelihood. I will say with these, just as a little, I guess, disclaimer with what we found here is, this is really just one point in time, and there are some limits with what we can say with the data. So what we're seeing is at this one point in time, this is the number of participants who reported these conversion practices. And yeah, that could have happened at any time in their life. And this is reporting suicide or self-harm in the last year, or psychological distress, which I think was in the last 4 weeks. So yeah, there are different, I guess, explanations for why we could be seeing this relationship. And there are different ways of looking at this, I guess, from this, quantitative perspective that could be more robust in terms of, like, you could follow people over time to see. But, I guess what we're most interested in is, the fact that we know from hearing people's stories, and there's good qualitative research, that people who have exposure to these conversion practices, they feel it harmful for themselves. And I guess what we can add with the data here is, you know, to what extent are people actually experiencing these? What proportion of trans people might be experiencing these? And, you know, to what extent that there might be these harms, and also, finding that our data are absolutely consistent with that. And so when you take it along with the other data, it's really consistent with the idea that these are really harmful practices. Okay, next slide. Thanks, Moira. So we wanted to not just talk about negative things as well. So we do, we have data as well on family support. And we found that most Counting Ourselves participants had at least one of their family members knew that they were trans or non-binary. And when we look at that particular group, more than half reported that most or all of their family were supportive of their gender. And in particular, our younger participants were more likely to report positive support from our family, which was something that made us feel more positive and thinking more positively about the future as well. So when we actually looked at the whole sample, not just the younger people, we found that those who did have that family support were much less likely. So 9% of those who had the family support had reported attempted suicide in the last 12 months, compared with 17 with those who said that their family were unsupportive or very unsupportive. So that's almost half the likelihood there. So yeah, what does this mean? Thinking about conversion practices as well. Families, whānau, who often they might require the support to be able to provide the support for their family, for their family or whānau person, and they might sometimes require this education around gender diversity. Jack will mention briefly that you know, in our findings we did find some association between family rejection and conversion practices. And we know that family rejection is linked with psychological distress and greater mental health problems. And what we did find is that some of that, I guess, statistical relationship could actually be accounted for by exposure to these conversion practices. And so, yeah, it's important that these are that there is the support so that these families are equipped to be able to provide support for their family members. Thanks, over to you, Jack.
So this fact sheet and the webinar are all about a call to action, and we know many of the people here have probably been involved in making submissions on the bill. And as we said when we made a joint submission with the Professional Association for Transgender Health Aotearoa, there's a real health rationale for the bill, because conversion practices can harm trans and non-binary people's mental health. As Jamie just said, people who experience family rejection were more likely to have been exposed to gender identity conversion practices, which may suggest that, conversion practices are one of the impacts, or one of the ways that a family that may reject a trans or non-binary person may also be involved in trying to pressure them into taking conversion practices. We also looked at the impact of religion, and for those who identify that they had a religion and that religion was not Christian, they had greater exposure to gender identity conversion practices than our other groups, people who had a Christian religion or those with no religion. We also had some other questions in Counting Ourselves where people talked about their experiences of rejection from spiritual and religious communities. And, there was a lot of comment, both, the numbers and also the comments people made about the importance of religion to them, and those experiences of leaving because they feared rejection or actually being tossed out. And this wonderful drawing that Huriana did for us was actually us wanting to imagine, moving from left to right, health professionals, whānau, and religious organisations that support the many trans and non-binary people in their lives and in their communities. So, I guess to finish, action is needed to support those harmed by gender identity conversion practices and to stop the practices. And it's wherever those practices occur, whether it's in religious settings, within family settings, or within, as our data focused on, within healthcare settings. And then we just wanted to thank everyone. These are all the people who helped us with counting ourselves. This is the same slide we use all the time because you're still part of the team. And, you know, we still couldn't have done it without you, and we won't be able to do the next one without you. We're aiming to have the next survey out in the field the middle of next year. And there's one slight change, which is we've added Tanako Kahukura as a thank you in the middle at the bottom because we couldn't do the fact sheets and this webinar without them.
Well, thank you too, Jack and Jamie. Thank you so much for sharing your research. We're going to have a bit of a conversation now around what this research means and what we think, how we think we stop gender identity conversion practices in Aotearoa. Just as a reminder, if you've got questions for Jack or Jamie or for any of us, just pop those in the chat. I can see a few questions have been coming through as we've had the presentation. But just to start with, I wanted to ask Jack, what's one thing you want to hear people talking more about in this conversation about conversion practices that's happening right now? What do you think might be missing from the conversation?
I think it's about what do conversion practices look like and understanding the breadth of that. And in particular, you know, it's not always someone dragging someone else off to a health professional or an exorcism and all of those sorts of things we think about. It's the friend who invites you for a coffee or asks you, really, will you just come to this meeting tonight? And the research overseas, we haven't got the data here except anecdotal, but the research overseas is that maybe up to a half of people voluntarily sought conversion practices. They went because it was someone they loved, someone who they relied on for support, someone they really, really trusted, who said, I really care about you and, you know, I think you need to change. And that is such huge pressure, such huge psychological pressure on people. And, you know, our communities often find it hard to name what happened to them, especially those who thought, oh, maybe I'll give it a go. You know, for my grandmother, for the church minister, for, you know, the GPI trust who says maybe I shouldn't be doing this, you know. So that's the picture I want, because I want those people to be supported. I want their family who maybe, or the friends who misguidedly did that, to realise that there are other alternatives and that what they did was harmful and that what they did would not work. And the really sad thing is, because we know from our data that connection to family, connection to culture are really huge protective factors for people's health and well-being. But you know, when someone you love, trust, cares about harms you in this way, conversion practices sever those connections. People leave religious practices because there's no space for them. People leave their family, or they find it takes a long time to find their way back. So that's part of the discussion I want. What do conversion practices look like, and what do we need to do to stop that cycle? Oh, and last thing, that's also why in our submission to the Select Committee, we said it was really important that the bill gets extended and covers something that's in lots of bills overseas, so that you actually prohibit inducing someone else to seek conversion practices. You mightn't have dragged them there, but you did all the things that meant that that's where they ended up. Kia ora.
So just the bill that's before Parliament at the moment is suggesting that trying to change or suppress someone's gender identity will be banned, but you're suggesting that needs to be broadened out to encouraging people, pushing people to a point where they essentially put themselves through these practices, right? Yeah.
Yeah, and the language in other laws is around inducing someone to seek conversion practices.
Yeah,
And it is
yeah.
banned in other places. Yes, that's exactly right.
Yeah, thank you. And I think it's so, like what you just said too, really illustrates why it's so important that consent won't be a defence in the proposed law as well. I know in some overseas jurisdictions, they have kind of exceptions around if somebody's consented to these practices, then it won't be banned. And that's just not how this works, I think. Yeah. Thank you. Jamie, I wanted to ask you, how is gender affirming healthcare different from conversion practices?
Yeah, thanks, Moira. And I think, you know, Jack has done a great job of explaining about conversion practices, and it's been great to hear those of you with expertise on policies and laws. Yeah, I'm so in awe of you folks. I think there's a number of, I guess, harmful and incorrect assumptions which we're seeing in these conversion practices, which, you know, sadly there still can be some prevalence within some healthcare settings. So obviously there's that idea of that being trans or even being queer, being gay, takatapu, whatever words you use, is a mental illness. It's something that's a pathology, something that you know could be treated or could be fixed. And particularly, you know, with being trans, there's been a lot of yeah, that's still something that's being working its way through, I guess, things like the diagnostic manuals, and it's great that, you know, it's the diagnoses related to being trans have been moved out of the international classification of diseases from the World Health Organization into an area of things that might be related to sexual health. So that's great progress, but there is still more work to be done there. So I guess this is the incorrect assumptions around the pathologization, the idea that being trans or being queer or whatever is a negative outcome, a bad outcome, that's something that should really be avoided. And the massively incorrect assumption that these practices actually work and that these might be actually helping people. So I think, yeah, just these really incorrect assumptions. And if you can, you know, actually be thinking about the affirming way, the affirming practice, I guess that's got to be grounded in the opposite, you know, the idea that, you know, that being trans isn't a pathology. It's something that's part of the fabulous part of human diversity, and that it's not something that's to be avoided. Necessarily, it's not something that's to be avoided as somebody who's in a professional capacity, seeing somebody else to try and change somebody or to not have them to be trans. That's yeah, moving away from that, I think is important foundation for practicing gender affirming healthcare.
Mihi nunuia kia korua, Jack and Jamie. I'm loving this conversation. This is the sort of stuff that gives me hope, as much as it's the pain that exists in our communities and for our siblings all over the country, and indeed around the world. But it still gives me that hope and that warm feeling that there's stuff happening, right? And there's beautiful humans like yourselves who are willing to put in the hard yards to get these conversations actually going. So we're going to give you a couple of minutes break for a bit, and I want to turn over to Moira and ask a question around what supports actually exist out there for folks who might have experienced conversion practices, but specifically around our folks who are our folks who are trans or non-binary. So Moira, what is out there?
Yeah, kia ora. I will answer that question, but I guess just to start with, I'll say there is a bit of a gap around specialist support in this area. So part of what we've put forward in the submission that we gave to the select committee was that people who've been through conversion practices really deserve to have free support from people who understand what they've been through and really the complexities of this experience. Like I think just reflecting on what Jack was saying, it's not just around the harm that it causes to an individual, but it's also around the harm to their whānau connections and the estrangement from their religion and their sense of faith, and the sense of their own identity as well. So I think there's really a space for a specialist support service to be developed with survivors of conversion practices, and really hoping that alongside this law change that's something that government puts some resource and some thought into. So with that kind of caveat, I guess, I would say there's support available from Rainbow community organisations. There's a list of those on our website. I guess one place I'd suggest is great to start would be Outline, which provides Rainbow affirming specialist counselling. So you can self-refer yourself to that, as well as a free nationwide peer support service. So that operates every evening between 6 and 9, and you can call or you can access that through web chat on the Outline website. There's also great organisations like Gender Minorities Aotearoa that provide specialist support, particularly around issues of gender identity. So there's a whole bunch of kind of community-based organisations that can provide support in different ways, and have a look at our website if you want to find a list of those. And I guess I just also wanted to say a lot of these practices are against the codes of ethics of professionals who might offer them. So if you've been mistreated in a health or disability service, for example, you can access a complaint service through the Health and Disability Commission. When you're receiving health services, you have the right to respect, you have the right to freedom from coercion, you have the right to make informed choices. So if a health professional has offered something that doesn't meet those expected standards, there are complaints processes that you can go through. The Human Rights Commission also might be able to support around complaints to do with discrimination. And also just wanted to mention actually the Royal Commission of Inquiry into Abuse in State Care. So if this is something that happened before 1999, if it's a historical thing, that inquiry is able to hear about those experiences and might be able to provide some sense of justice around those things. So those links to all of those are on our website as well. We'll share a link to that at the end of this this kōrero. But yeah, thanks for the question, Jono.
You're so welcome, Moira, and thank you for that amazing and comprehensive response as well. I am actually going to shift across to Joey now and throw a question to you, my friend. So this is a heavy conversation, and there's lots of stuff in here, and I just am aware of how much it lands like in the heart space and in the soul space for a lot of us. So what do you want to tell our trans and non-binary people and their whānau who might be watching this?
Kia ora koutou, and kia ora Jono for that question. Feels like a big one. I think we all wanted part of the goal of this webinar, alongside wanting to contribute to the conversation about banning conversion practices with strategy and data and clear evidence-based kind of recommendations. We wanted to also recognize the extreme effort on emotional, spiritual, every kind of level that it takes to engage with this kind of topic, and that trans and non-binary people, or more broadly rainbow people, Takatapui people, we have been really carrying a lot in this process. And as a lot of you will know, working in that kind of sector, there's a lot of legislative stuff going on at the moment, and there's a wider context of a pandemic. There's a lot of reasons why we might be feeling tired at the very least, but also potentially just really, I know for myself, I feel quite pained quite often when this topic is circulating, and I think it's a valuable conversation and I welcome it. And my message mostly to trans and non-binary people and their whānau is that I think you're amazing, and I have so much love for all of my trans and non-binary friends and whānau, and they are the reason that I am here, and they are the reason why so many of us do this work. And I want to recognize the huge, huge contributions that you are all making to being part of this conversation and being part of stopping conversion practices from happening, and really more than a law change, like uncovering why does this happen and how can we address it on a interpersonal, social, familial way, and also how can we resource community organizations to be driven by the leadership of trans, non-binary, Takatapui, rainbow people, resource our organizations to address, the wild, out of control public discourse that's so transphobic so often, or so racist so often, or provide specialist support, like Moira was talking about, provide specialist support, not because, rainbow stuff is a specialist area and you need to be specially trained, but because there is something really important about by us, for us. And I think counting ourselves is a great example of that too. Like, this is what Te Ngākau Kahukura stands for. It's what counting ourselves stands for. And yeah, so my heart is with everyone who is dealing with this process. And I think also particular mihi to Dr. Elizabeth Kerekere, who's been part of that process of receiving people's oral submissions. And if anyone's been watching the oral submissions processes, they are grueling. At times people are being amazing and articulate, and as you might expect, just saying the most clear and concise or deeply personal and troubling experiences that are extremely relevant. But Elizabeth has been holding that, receiving that for us, and I want to recognize her for that act of service. So yeah, that's my thought. I know that, Jono, I'm thinking about a question for you before we move into questions from our audience, which have come through. Please keep putting your questions in the chat. That's really helpful. You have a lot of experience working in kind of that overlap of social work and youth work. And I'm thinking about your work with Te Ngākau Kahukura is often about being the practice lead and demonstrating how people could frame their work as a youth worker, as a social worker, but also broadly as anyone working in health and social services. How can they frame this issue? What are the implications for people working in those services? What's the implications for youth work practice, for social work practice?
That is a big question, and we could do an entire webinar around that as well. But I think one of the things to think about here is that so often practitioners will lean on what does evidence say? How do I know, or how do I prioritize, or how do I think about this stuff? I had one client who was like this, or I had one person that I'm serving who was like this, but is that everybody's experience? So I think at a baseline, just even thinking about counting ourselves in its entirety is an amazing resource for saying trans and non-binary people exist, and they need to be part of your considerations when you're doing your practice. That as much as there's specialist elements to the work that, like you've all said, sometimes you need to draw on specialist or expertise in spaces, you as a practitioner, especially in the social work, youth work, even counseling, clinical fields, all of those spaces, anywhere where your role is to help and support people, that you need to build this stuff into your practice and make sure that you are serving the people that you are serving, not the systems that you serve within. I think the other part that gets really, I guess, missed a lot of the time as well is that when we start to think about the conversion practices, often people go to that space of, oh, it's conversion, they're trying to make people straight again from their non-heterosexual proclivities, or whatever the hell you would like to call that. But the idea that, and Jack, I love that you spoke about it as being not just like what is effectively abusing people with physical force, but also that kind of more subtle psychological stuff, and that the data talks about, and you both, Jamie and Jack, mentioned that some folks were like, oh, I never had a language for that. I didn't know that that's what that was called. Being able to identify that conversion practices are a huge range of things, and it's any time that somebody is trying to suppress the identity of somebody that they're serving, that that needs to be built into our critical reflective practice as practitioners, either as social workers or as youth workers or anything else. And I really acknowledge that, because that's how we start to shift our practice. That's how we start to, again, center the people we're serving, rather than think about, oh, I've got this paperwork to do and I've got these things and I don't know any queer people in organizations, or I don't know a rainbow organization, or any of that stuff. It just comes back to, how as a practitioner do I hold adequate and loving and caring space for the person sitting in front of me, who is saying, I need something, anything that's going to make me not feel horrible anymore, or feel stuck, or feel trapped. Yeah, I will leave it there, because I think, as I said, I could keep going, just
I
because
appreciate it. Thank you, Jono. It is, we are having some questions come through, and I am going to turn to those now. And if anyone wants to keep putting questions in the chat, we will be keeping track of that. I think maybe it did come through as one of the first questions, and it's about the oral submissions process. So this is not specifically about counting ourselves, but about if some people are yet to do oral submissions, do you have any tips or points to raise about what to keep in mind when they're doing that? Or like, yeah, I guess, are there key messages or points that I'm thinking this is directed at Jack and Jamie primarily, but certainly Moira, Jono, welcome to weigh in. Anyone have any thoughts?
I could jump in, just because I ran a session for Outline about this before the select committee process started. 3 things that come to mind. One is just, this is less about what to say and more about just how to think about the process. Yeah, number 1 is you've got 5 minutes, so just do some preparation around what you want to get across, write down some bullet points, maybe write yourself a script. And I guess as part of that, if you are sharing a personal story, just, yeah, think through how much you want to share of that, and just be aware that that's a public process. Unless you ask the select committee for it to be private, they can hear a submission privately. But by default, it's public, and these hearings are live streaming on Facebook, and there are people watching them and commenting on them from a range of perspectives, including some quite hateful ones. So if you are sharing your own personal story, just have a think through what you feel comfortable being public and being recorded and staying online potentially forever. And I guess my 3rd tip is just to have a friend particularly in these strange lockdown times, where a lot of us are either in our own kind of bubbles in Tamaki Makaurau or up north or in the Waikato, or you know, the processes are happening online by default. The last time I appeared in front of a select committee in person, I had a little group of supporters behind me, and afterwards we went out for coffee and we could kind of talk about it and gripe about one of the silly questions that somebody asked me, and that's just quite a good way of debriefing around the process and just taking care of yourself. So I think that would seriously be a tip that I would have, is think about who you can have a talk to afterwards. Have a friend who's watching along with you and who you can just have a chat with.
I think those are helpful tips. Jack, you unmuted yourself briefly, I think.
Yeah, and maybe it's a question to Moira, because I know Moira, and actually we've got Kay on this call too, who I know I still ask some questions, who has watched lots of the submissions. I was wondering, you know, are there some questions that keep getting asked? There's some questions that keep getting asked that are just mischievous ones that we don't really need to respond to. But I guess I'm reflecting on the last bill that, you know, we got the select committee report on birth, deaths and marriages just this week on, you know, about legal gender recognition. And it felt through that process that really they just took all the ones from us that were great and all the ones that were awful, and they balanced each other out, and they largely went with what they started out with a few tweaks around the edges. I don't know how much is going to change. So my hopes for how much will change, I guess, have been diminished quite a lot from seeing that first process, but I know that this one has got a longer time period. But I wondered if there's some questions that give us the impression that they're grappling with not knowing how to deal with some things. I suspect there's less of that with this one because there's so many other countries that have been doing it just recently and they're looking at those. But yeah, I wondered, Moira, were there any questions where you think it is a genuine, the select committee is not sure yet? And I guess we could also ask, our friends on the select committee, maybe there's some of those questions as well.
I'm not sure. I think I'd agree with you that it's really hard to predict how much influence this process can specifically have, and really easy to be cynical. I think my general impression from watching a lot of the hearings is that definitely in terms of numbers, there's more people showing up who have written in from a religious perspective. They've perhaps copied a submission. There are some big submissions that went out from churches that are saying very much the same thing, and so people are often turning up and saying those key points, and often saying quite hateful and negative things about rainbow communities, and particularly about trans and non-binary people. So I mean, I think just showing up and being able to share perspectives from our side of things, from the rainbow side of things, is a positive thing in itself. And I think is helpful for the committee in terms of understanding that even though some of those conservative perspectives are showing up en masse through this process, they're not actually the majority viewpoint of the public. Like, I think to come along to these processes, you have to have some stake in the issue, and so they're getting quite extreme perspectives from either side. And so I think just being able to show up is important.
Yeah, and different organizations are and individuals have different recommendations. You can find our recommendations on our website. And so, yeah, we're not really telling people what points they should make, because different people will think about that differently. Like Te Ngākau Kahukura really prioritised education and support for survivors and whānau, like education broadly and resources for whānau. But we felt like that was something that the law really needed to encompass, like provisions for that, resourcing for that, rather than just focusing on banning something. So, but different organisations have different takes. I want to move to more questions because we do have more coming through. I want to acknowledge that a lot of people do have difficult times with churches in relation to this, and some people have mentioned that in the chat. And there's a particular question that just came through recently that I thought was really relevant. Now I'm trying to find it. So, is there anything, this is about specialist support for survivors being crucial, is there anything we can do in the religious space to ensure these practices are truly abolished after the ban? Does it feel possible when homophobic and transphobic concepts are so entrenched in the ideology potentially? And an acknowledgement, that's a big question. But any of our panelists got a thought on that?
I don't know, that is a very big question. I don't have an answer to the whole thing.
Yeah.
But just to add a reflection from watching the select committee process, which is that religious perspectives have really run the spectrum, actually. I talked about conservative religious perspectives, but there have also been people showing up who have really spoken to how Christian theology particularly supports actually the idea of love and the idea of supporting each other and family and acceptance, and they've encouraged the lawmakers to go further in terms of like not having any religious exceptions, and wanting to encourage their churches to really grapple with this. So I think there are some people in religious institutions who are doing some of this work as well, just to acknowledge that.
Maybe another, Jack, do you want to respond?
Very quick, just that many of us, I get that for some people wanting to able to make a complaint and to actually get a criminal or a civil action against someone is really important to them. And I totally agree with Te Ngākau Kahukura that, it's change happening within communities by those who are part of those communities who are trying to push for change that is going to make the biggest differences. And so that means, you know, culturally appropriate, resourcing for culturally appropriate responses, resourcing for things in the right part of the country, for things to happen, you know. So it's, I think it's really devolving some of the, you know, where best practice can happen to people who are having those conversations. There's as much use me going into a religious setting to talk about things as there is me walking onto a rugby pitch. You know, I'm as good as at both of them probably. Other people could do that really well. Actually, Jono looks like someone who could do both of those quite well. You know, just a guess.
Shall I move on to another question? Or Jono, do you feel tagged in by that?
You can move along to
All right, I will.
That's absolutely fine.
Some of the framing of the question I'm not totally sure about here, but it's about some submitters have talked about applied behavioural analysis as a form of conversion practice. Did the study, I think this means counting ourselves, recent data, uncover any references to this applied behavioural analysis? Is particularly could be relevant to neurodiversity, that kind of space.
Unfortunately, we didn't. One thing we wish we did is, well, throughout Counting Ourselves, we often had open comment boxes for people to give a little bit more context on their experiences, and we didn't get any very much more detail on what it actually looked like with these exposure to these conversion practices. I think it's such an important point, though, and in terms of the similarities with ABA, and thinking about it from myself, my own background as somebody who's a lecturer in a psychology department, that is something that's, I guess, something that I have some familiarity with. And I was thinking as well that perhaps there are some ways that I could help as an ally from within that space. So if anybody wants to reach out to me, I'd be more than happy to help with that. It's not an area I have I do particular work in, but definitely as an ally, I think that's really important, that I may be able to help there. And I guess I think the issues are really the same, right? Like, I think it needs to be about being led by the communities that are being affected, that autonomy and that community leadership. And yeah, you know, law change is not everything. Obviously, we need to be thinking about how we can change people's attitude, or what some of these biases and the stigma is out there, to stop these things from happening even in the first place.
And such similar underlying logic, like anything that seeks to quote unquote normalize is pretty suspect, and going to be doing that in service to probably the ongoing colonial project and the various anyway, that's a
psychopathologization, et cetera, it's part of that.
Yeah, thank you. Anyone else wanting to weigh in our last couple minutes on that question, or shall I try and move to a different one? Yeah, move on. Okay, I'm picking one here. What should we do if we know or hear about a trans or gender diverse member being coerced into some form of conversion practice in order to retain their employment with a company, say? It's the kind of practical question. I'm not expecting that our panelists will necessarily have an answer prepared because it's quite specific, but do you have any reflections on how to respond if you see someone being coerced into that kind of harmful context?
I'd really love to see the material and the resources that get produced, particularly with the civil process that will be introduced, that would be through the Human Rights Commission, which I think they will need more resources to do it well.
Yeah.
About really practical questions like this. You know, and some of it will be, yes, you could, you know, make a complaint to us, and how long that would take and what we'd do, which would be effectively, it's a bit like the answer to the question someone said about what would, if something was happening within a religious context. For the Human Rights Commission process, it requires both parties to want to come and sit down together or in separate rooms and talk. That may or may not happen. But, you know, I have a trade union background. If you trust if it's a unionised works fight and you trust your delegate, talk to them. If you don't trust your delegate, call the union, because hopefully the union would be support. Many unions have made submissions on this. The Employment Service, they should have material and they need to train their frontline, the staff who answer the phone, because this will be unlawful. And also knowing the broader stuff, which is that people often don't complain about unlawful things in workplaces because they just want to keep their job. And, so then that's about, organising within workplaces, and also, about the sorts of training that happens internally. And lots of us work in really small places where we're casualised and all of that. So how do we, improve employment rights for casualised and precarious, people in those circumstances? But the messaging that comes out with the bill has to talk about these really practical, real life examples. What do I do? How do I get support?
Absolutely. And I think it highlights the difference between saying we'll set up a complaints process, which obviously is a thing that needs to be resourced to be able to be held and managed well. And that's great. That's what a lot of health services do. They have complaints processes, and we had a comment in the chat about that. And of course, like, there's a place for that being potentially extremely useful, but it's also asking a lot of people to go through that. And if you're doing that, but you're not providing the kind of support that people might need to just heal and have their own process and journey with it, if you're not doing specialist support that is trauma informed, that is responsive to the needs of the community that it's set up to respond to, then you're really asking people to do a whole lot of labor rather than get support, even though making a complaint often gets framed as like, oh, well, that's a thing you can do if you had a bad time. And it's like, well, that is a huge effort. And I recognize anyone who has done that for anything it's a big ask, and thank you for doing it. It's very worthwhile, but it's unlikely to be the place where you find healing and support. So there's such a need for that to be recognized as part of this. I'm aware that we're at 2:28 and we do have other questions, but I will stop there so that we have a chance to close our webinar. And I want to acknowledge the really wonderful comments that have come through from people and the questions, and to say again, yeah, we are interested in being part of this conversation, Te Ngākau Kahukura, and counting ourselves. And we know that there are a lot of people doing really impressive work in this area. Thanks, Jamie's answering one of those questions in the chat that we didn't get to. That's great. I was like, maybe I can ask that. No, I won't have time. Shall I hand to Moira to wrap this up for us?
Oh, kia ora. Thank you, Joey. Thank you so much, Jack and Jamie, for sharing your mahi, and thanks, Joey and Jono, as well, for your contributions. I think this has been such a useful conversation, and yeah, really hope that we can continue contributing to this work around how we support people to find healing and justice in response to these practices. I've shared a couple of links up on the screen. As Jack and Jamie have alluded to, there's a new fact sheet from Counting Ourselves around the research that they talked about today. So you can have a look at that on their website, and on our website. We've got a resources section around the current proposals to ban conversion practices. So you can have a look at what we told the Select Committee, our submission, as well as other research and background and personal stories about people who've experienced these things in New Zealand, and also a list of those support services that you can access if you're looking for help, either for yourself or someone else. So have a look at those. The recording of this session will be up on our YouTube channel as well shortly. So feel free to watch again, share that around with anybody else who might have missed this. Wanted to say as well, I guess in terms of the law change, the Select Committee process is still going. There's some hearings happening today even. Those are live streaming on Facebook. And just to reiterate really, I think what Joey was saying around, if you are watching those, just take care of yourself. The presentations can be quite upsetting. There's some examples of people sharing quite intense anti-trans, anti-rainbow beliefs. And also some stories from survivors of conversion practices talking about their own experiences. So it can be quite an upsetting thing. I found it very interesting and very, very informative, but not necessarily always a very fun thing to watch. We are expecting the law change to go through early next year. So Labor has signalled that they want to have this ban in place by February next year. So that's what's happening with that. Yeah, and with that, thank you to all of you for being here with us. Thanks so much for your engagement in the chat with asking lots of questions. And thank you again to Jack and Jamie for being part of this conversation with us, and to Joey and Jono as well for helping to hold this session. See you all again soon. And just to close with a karakia, me karakia tātou, unuhia, unuhia, unuhia ki te uru tapunui, kia wātia, kia mama, tīnākau, te tinana, te wairua i te karatakata. Koiara e rongo whakaere ake ki runga kia tīna, tīna huie, taiki. Kia ora, thanks everybody.
Thanks everyone.